Okay, today I'm going to be demonstrating how to give a sub-Q injection. The first step would be to obtain the physician's orders. Then I'll go ahead and gather all of my supplies and check to see if the patient has any allergies, either to this medication or any other allergies that I need to know. Then I'll go ahead and I will wash my hands and follow the 6 patient rights, which is the right patient, the right medication, right dose, right time, right route, and right documentation. Then I'll go ahead and check to make sure that I have the correct needle gauges, and in this case I am using a 25 gauge 5/8 of an inch needle. You can also use a 23 or 26 gauge and a 1/2 inch or 3/8 of an inch length of the needle. And I'm also using a 1 milliliter syringe. Then I'm going to go ahead and I'm going to check the medication 3 times. I'm going to check it at the Pyxis when I'm drawing it up and at the patient's bedside. I'm going to be checking to make sure that it is the exact medication. In this case, it should be heparin, and I will check the dosage and the expiration date, make sure it's not expired. So then I'm going to prep the medication. I'm going to be drawing up the medication before I get into the patient's room. So I'm going to start by wiping the top of the vial with alcohol wipe to sanitize it. Make sure nothing contaminated goes inside of the medication bottle. And then while that is drying, I'm going to draw up 0.5 milliliters of air. Then I'm going to inject that 0.5 milliliters of air into the bottle. Then I'm going to turn it over and pull out 0.5 milliliters of the heparin.
I missed the antidote and I missed the values.
And I'm going to use the scoop method to pick it up so as not to poke myself. Then at this time I'm going to switch out the needles because this is a 1 inch and I just used it to draw up the medication. I'm putting the 25 gauge 3/8 inch needle, and I'm going to verify it with the nurse that this is 0.5 milliliters of the heparin. So then I'm going to label it and bring it safely to the patient's bedside. So as soon as I enter the patient's room, I'm going to wash my hands. I'm going to introduce myself, explain the procedure and what I'm doing. I'm going to be giving the 0.5 milliliters of heparin. And after I'm done washing my hands, I'm going to go ahead and apply my gloves. I'm going to identify the patient with 2 identifiers, their name and date of birth, check their wristband, and I'm going to ask the patient if they have any allergies or ask their significant other if they're unable to tell me, or I can check to see if they have an allergy wristband. Then I'm going to assess the patient's vital signs, and I'm going to check their platelet count, and keep in mind that the antidote for heparin is protamine sulfate, just in case the patient needed it if they were to have an adverse reaction after I administer the medication. The different sites that I can administer the sub-Q injection is the abdomen, the back of the arm, the love handles, the top of the buttocks, and the outer part of the thighs. Okay, so I'm going to go ahead and give the injection. So, before I do, I'm going to go ahead and wipe the site that I'm going to be injecting first. And then while that air dries, I don't want to fan it, I'm going to get the needle, and then I'm going to grab a 1 inch fold of the skin, and with a dart-like motion at a 45 to 90 degree angle, I'm going to inject the medication slowly. I'm going to let go and release and use the scoop up method. Then I'm going to dispose of the needles, and if the vial is empty, I will dispose of that in the sharps container as well. and I'll make sure that I do not rub the site location after the injection.